I'm very excited, yes. Been wanting to do this for a long time. What they do is they take the underlying tissue and the muscle and the skin and pull it up and remove it. And what I'm wanting to correct is my lower jaw area, my mid-face, you know, the nasolabial folds, and my neck. And I think this procedure would be very good for that. They make a little incision right behind the ear. There's a tiny incision in front of the ear, in the hairline, and then they pull the skin and the muscle and the tissue up. Well, you know, I guess a little bit nervous, not too much. I'm pretty confident in, you know, Dr. Edelglass and the crew that's doing it. I feel very good about them, and I think they'll do a great job. And you can't wash your hair for a week. That's so, you know, that's why you have to really take a week off. I don't think you really have a lot of pain with it.
Okay, what we're going to do is mark our incision so we get this exactly right to leave the smallest imperceivable scar for you, and make sure that you get the best results. What we're going to do now is, okay, going to mark out the boundaries. You feeling well rested?
Yes, sir.
We're going to make it more beautiful. In just 2 hours from now, you're going to see a fabulous new Rosemary.
Yay.
Yay.
For this procedure, we use a conscious sedation anesthesia on these patients. What this entails is we start an IV on the patient, and this allows us the access to give them medication that will make them very comfortable and sedated, where they tolerate the procedure very well.
As we prepare Rosemary for surgery, we put a little oxygen in her nose. This just keeps her safe. And we start applying all of our monitors.
Feeling that medicine a little bit?
This is the beginning of the procedure. Dr. Edelglass has already done his initial incisions. He is now undermining the skin. That essentially means he's taking the skin up off the underlying tissues. And the underlying tissues are what we're really trying to work on. Gravity and time have pulled them down, and Dr. Edelglass is going to put them back where they were.
What we're doing here is we made the incision in the skin crease. We're now opening up, separating the skin from the muscle.
This is the very end of the procedure. Dr. Edelglass has completed the facelift. Rosemary is looking great. We are just doing some final skin closures. The skin closure is done with a 5-0 or 6-0 fast absorbing gut. It's an absorbing suture, and it's about the size of your hair. And this would conclude the surgery. This is immediately after the surgery. You can see that Dr. Edelglass's tailoring skills have allowed no tension on the suture. This will make a very, very small scar, if any. It will look beautiful. Aha! Welcome to Rosemary. 2 weeks, 2 days post-op quick lift. She used to have a chin that was about here. Now if you look up, and then show us from a profile side. Very tight, very nice. Scoot back towards him, and straight down. Her face is getting back to being a triangle instead of a square. As you get older, your face kind of pulls down, makes it square. On a lady, this is not what we're looking for. quick lift has pulled up her cheeks very nicely. Her jowls are gone. Under her chin looks beautiful. And I'm going to pull her hair back here just a bit and turn this way. She's still got a little of the pink on the scar, but as you can see, it's smoothing out very, very nicely. This will all disappear. She can cover it more with makeup, but for your filming pleasure today, we've left it off.
I'm so happy I did it. I mean, it was like, I knew things weren't right, in my face. I knew I needed to do something, and it was just making the right decision. And finally, with the help of Barbara and Dr. Eva Glass, we decided this would be the best thing for me. We tried fillers, and the fillers really help a lot. They do take care of a lot of the problems, but I was at a point where I needed more.
So she came to the OR, and more happened.